I'm going to show you an exercise which is going to load up your gluteus medius and gluteus minimus tendons, which sit on the side of your hips. They attach into the greater trochanter, the bony bit at the side of the hip. And if you're getting pain, lateral hip pain, greater trochanteric pain syndrome, pain on the outside of the hips when you're walking, going upstairs, going up hills, lying on your side, those kinds of things, it might be that that tendon, maybe the bursa around there, is a bit implicated. So this exercise is about putting some load and some force through the side of the hips. And I'm going to show you 3 different positions that you can do it in. To do this, you just need to get a stretchy bit of band, either a loop of exercise band, or you can get some just piece of TheraBand and tie it in a loop, or you can even just do this with a belt that's not really that stretchy. Just tie the belt together so it makes a loop, and then you're going to put it around your knees. So the position of your knees versus your hips and your feet that you're going to get into is feet about hip distance apart, and then pressing your knees out into the band to be about hip distance apart. First part of the exercise, I'm just going to move this down here. You're going to come up into lying on your back. Probably get rid of these. So lying on your back, feet hip distance apart, knees pressing out into the band. Okay, this is the first bit. So knees pressing out and holding. 3 breaths, in and out, pressing and holding, and you should start to feel some work maybe around behind here and the side of your hips. And relax. Repeating that 3 times or so. Pressing out, holding for about 3 breaths, about 20 seconds. That's the first part of the exercise. And then if that's, once you've had a go at doing that, you're maybe, depends on your condition, but you've had a good trial at doing that and you feel like you're managing that and you're maybe managing it for longer without it being painful, then breathe into your tummy. Exhale, press the knees out. Breathe in to hold the knees out. Exhale, squeeze and lift the hips. Inhale to come down. Exhale, squeeze and lift. Exhale to come down, or inhale to come down, sorry. Exhale, squeeze and lift. And the whole time you're keeping the pressure pressing out. So the knees are pressing out against the band. You're trying to maintain the knees being in line with the hips and not letting them drop in towards each other. And they don't need to be pressing out further than the hips. You're just gently pressing out to keep them in line with the hips. And with this, we might do 15 repetitions or so, lifting and lowering. And if you feel like your hamstrings are doing too much of the work, so if you're feeling it behind your thighs, you can step your feet a bit closer up towards your bottom. But you're still keeping this pressing out. So that's the first part of the exercise. You can also progress it to sitting. In sitting, feet hip distance apart. Knees press out to be hip distance apart. This is the first part. Come into your center, draw up, let your sit bones root down, crown of the head reaches tall, and you're just gently pressing your knees out, holding for 3 breaths, relax, repeat it 3 times. And to progress that exercise, press the knees out, breathe into your center, and as you exhale, shift your weight forwards and come up to stand. Inhale to sit, exhale to stand. All the while, knees gently pressing out, seeing if you can maintain this pressing out on the band. To progress that even further, we go up to standing. In standing, knees pressing out into the band, breathing into your center, draw up as you root down through your heels, bending the knees, coming down and coming up. So from standing, squatting down, and standing up again, all the while keeping this gentle pressure out on the band, not letting your knees drop in. So that's 3 different stages of that exercise: lying, sitting, standing, with this pressure pressing out of the knees into the band to get your glute med and glute min muscles working, loading up the tendons that attach onto the greater trochanter.